mindfulness, or the practice of being fully present in each moment. It comes from an ancient Buddhist approach to living, and it is said to reduce stress, increase self-awareness, and cultivate well-being. It's a teaching that Harvard is now investing in big, putting $25 million into the Thich Nhat Hanh Center for Mindfulness in Public Health. And the center will house a number of research in initiatives looking to assess the impact of mindfulness on health and wellness. I'm joined now by the center's director, Dr. Walter Willett. He is a professor of epidemiology and nutrition at Harvard. And Naisha Deed, she's the founder and CEO of Pure Spark, an organization focused on Black mental health. Welcome. Thank you so much for your time.
Great to be with you.
So, Dr. Willett, let's start with this center and your connection to this philosophy and why it connects to the work that Harvard is doing.
Yeah. Well, actually, my connection with Thich Nhat Hanh, for whom the center is named, goes back quite a bit in time. When I was in medical school in the 1960s, the Vietnam War was raging. And myself and some other medical students were wondering what's going on here. So we invited this young Buddhist monk who was in the United States to come and talk to us about what are the origins and the meaning of the Vietnam War. And it was Thich Nhat Hanh. And he was very informative. We learned a lot from him during that time. And it changed the paths many of us took in our lives. It was only more recently that we connected with a common interest in food and how that can relate to mindfulness, and more recently in the relation between what we eat and planetary health, which is all part of the mindfulness vision of the world.
And Naisha, you know, a lot of folks think mindfulness and maybe they think of like yoga culture. They don't necessarily think of that connection to mental health, the connection to social health, nutrition, and things like that. So talk to me about what that means for you and the city investing, you know, places like Harvard investing in it.
Yeah, I mean, I actually love to hear that modern medicine is now catching on to these ancient healing practices. As a person who experienced depression and having a diagnosis of bipolar disorder, I never thought something as simple as going outside, getting some fresh air, stepping away from modern day technology would be so helpful in my own wellness, right? And mindfulness and mental health go hand in hand. I mean, they're totally connected. So you talk about yoga, that's something that I practice every day, and it's something that I encourage people, if they're interested and open to it, to practice as well.
And there's more of a buy-in, Dr. Willett, right? Like I see businesses really bringing in that mindfulness piece. You talked about nutrition and the public health sector. It's something that goes hand in hand in terms of productivity and all aspects of our life.
Absolutely. A lot of the focus on mindfulness research until this moment has been mostly about individual health and well-being, and that's very important because if we don't have that, we can't be productive, we can't be happy. That's a beginning, that's a floor. But in this center, we hope to take mindfulness another step into the public health world. And one of the aspects of mindfulness is connectivity, how we ourselves are connected to everything around us, to other people, our environment, ultimately our planetary health as well. So we hope to combine these different levels of mindfulness. And as you say, it's being appreciated across businesses, across many different organizations that are beginning to understand even more and more that they can't be a successful organization, whether it's for making money or doing good in the world in other ways, unless they have healthy employees, both physically and mentally healthy.
Naisha, in your work, when you go and say you consult with a company or an organization, I mean, how do you make them understand that that connection between mindfulness, wellness, mental health, is it connected to their productivity?
I mean, I think that when we think about mindfulness, sometimes we think about someone seated cross-legged, you know, with their hands in a mudra and, you know, with their eyes closed. And Sometimes people think it's a little kooky, right? They don't necessarily see the connection. But I can tell you that when we feel better, right, we think clearer. I don't think a lot of people understand that when you're dealing with, or if you've ever dealt with a mental health concern, as in depression, how it impairs you cognitively, right? I remember dealing with it myself and thinking, am I dealing with Alzheimer's right now? My memory had gone, completely missing, right? I could not think clearly. So these are the things that will get in the way of productivity, right? If we can think clearer, if we can have better memories, then obviously we're going to be able to get the job done better.
And it can also affect the people around you too. Like if there are individuals or if there's a group of folks that aren't working to their best or aren't their best, and don't have that mind-body connection, it can affect everything.
Absolutely. I think that it's contagious, right? Just like we think of bad moods being contagious, good moods are contagious as well. And when I take care of myself, I can better take care of my community, whether it be my community at home or my community at work, right? I can come to work with a better attitude. And when you're working around people that have good attitudes, then the sky's the limit, right?
Yeah, it seems like, Dr. Willett, there's a growing number of researchers that are making this argument that mindfulness is better for all cognitive processes, and that's why the research dollars are there.
Absolutely, and there have been about 25,000 publications in this area over the last decade or so, and that's increasing rapidly. So we do hope to contribute to that knowledge, and in our own field of public health, mindfulness connects literally every day with what we do, because in traditional medicine we're usually talking about one person at a time, but in public health we are dealing not with just that individual, which is very important, but everything and everybody around that person. And we didn't do so well, for example, during the COVID pandemic with masks and immunizations, and we realized in public health we need to do better. And part of that is conveying the knowledge, the information, and also how to do it with things like wearing a mask. It's not just protecting me from COVID, it's protecting my family, it's protecting the people I work with, the other people in my community. And so it's not just that I get better, but so they can, if they be healthier, go to work, so kids can go back to school. Everything is connected. And I did want to mention this. It comes out of a Buddhist tradition, but it's actually, as Thich Nhat Hanh pointed out, this is embedded in many ancient cultures. Socrates said, no man is an island. We'd say no person is an island today. But he really understood that everything we are, everything we do is connected to others in the environment around us.
What are some of the aspects of mindfulness that you hope to do research on, in this new center?
It's two areas of emphasis will be nutrition. It's actually housed in our Department of Nutrition, but it's meant for the School of Public Health as a whole and the university as a whole, and also environmental health. Those are two areas where we're very active in nutrition, especially being mindful, again, about what we eat, how it was produced, who produced it, what are the effects on me, the consumer, what are the effects of me consuming that food on the environment, and working especially among children and also in the later stages of life.
And Nyesha, in our final minutes or so here, when you see investments like this, and I asked you this before, but I also think about when we're talking about nutrition and we're talking about overall wellness, where do you see this field going in terms of benefiting the communities that you serve and other communities as well?
Well, I'm excited with the potential, right? I think that what COVID did was help us to kind of really see all of the disparities, specifically within the Black community when it comes to health equity and health justice. And I think we're just getting started. And I'm really excited about reimagining what health looks like in my community. I see a day where, maybe we can have farmland and we can go to the farms and pick fresh fruits and vegetables for us to eat. We do understand the connection between food, the gut, and the mind and overall well-being. So, being able to attack these things kind of at the root is where we're going to really see some big changes. But it takes time, and I think that we have to be patient, and also it takes imagination as well.
All right. Well, Dr. Willette Naisha Deed, thank you so much for your time.
Pleasure. Thank you, Crystal.
Yeah.